Hello guys, today we gonna see about general surgery case about right iliac fossa mass. Here starts as Mr. Palanisamy, 62-year-old male, farmer, coming from Ravuzapati, came to the OPD with chief complaints of lump in the right lower abdomen for past 5 months, pain in the right lower abdomen for past 1 month, no fever, no chronic cough with expectoration, no evening rise of temperature, no jaundice, no back pain, no chest pain, hemoptysis, breathlessness, no painful urination, increased frequency of urination, hematuria, no bone pain, no jaundice, no back pain, no chest pain, hemoptysis, breathlessness, no painful urination, increased frequency of urination, hematuria, no bone pain. Past history. No similar illness in the past. Not a known case of tuberculosis, diabetes mellitus, hypertension, bronchial asthma, epilepsy. No previous surgeries or hospitalization. No blood transfusion. Personal history. Patient consumes mixed diet. Smoking for past 30 years, for day. Smoking index, 120. Patient used to consume alcohol for 20 years, 180 milliliters of brandy per day, stopped before 10 years. Not a tobacco chewer. Altered bowel habits. Normal bladder habits. Family history. No similar illness among family members. No deaths due to cancer in family. Allergic history. No allergy to drugs or food. Socioeconomic history. Patient belongs to lower middle class, LLL, according to modified Kupuswamy scale. History summary. A 62-years-old chronic smoker presented with a lump in right lower abdomen for past 5 months and pain in the same area for past 1 month with history of easy fatigability, blood in stools, altered bowel habits, loss of weight and appetite. He was a chronic alcoholic in the past with no significant family history. The probable system involved is gastrointestinal tract, and I would like to proceed with examination of abdomen. General examination. Patient is conscious, oriented to time, place and person. Moderately built and poorly nourished. Pallor present. Not icteric. Not cyanotic. No clubbing. No pedal edema. No generalized lymphadenopathy. Vital signs. Pulse rate, 86 per minute, regular in rhythm, normal in volume, no specific character, no radioradial or radiofemoral delay, no vessel wall thickening, all peripheral pulses were felt. Respiratory rate, 18 per minute. Blood pressure, 110/70 mmHg, in right arm in sitting posture. Temperature, 98.6 F. Examination of abdomen. After getting consent from the patient, in a well-lit room, patient was examined in supine position with arms by the side, after exposing from chest to mid-thigh and myself standing on the right side of the patient. Inspection. Abdomen scaphoid, umbilicus in midline and inverted. All quadrants of abdomen moves equally with respiration. No nodules, scar, sinus, dilated veins, visible pulsation. No fullness, visible intestinal peristalsis. Flanks free, hernial orifices free, external genitalia normal. Renal angle free. No fullness in left supraclavicular fossa. Palpation. Patient in supine position with knee flexed. No local rise of temperature, not tender. A non-tender, fixed mass is felt in the right iliac region of size 5 by 4 centimeters, irregular in shape, extends. Medially 6 centimeters from umbilicus. Laterally 3 centimeters from anterior superior iliac spine. Superiorly 7 centimeters from right costal margin at midclavicular line. Inferiorly 8 centimeters from pubic symphysis. Firm in consistency, with irregular surface and ill-defined margins. Leg raising test, Carnet's test, mass not palpable after leg raising intra-abdominal mass. In knee elbow position, mass become less prominent, intraperitoneal mass. No guarding, rigidity. No other mass palpable. No organomegaly. Mass is not bimanually palpable. Renal angle normal. Left supraclavicular fossa normal. Hernial orifices free. Percussion. Impaired note over the mass. Liver span, 12 centimeters, normal, no free fluid. Auscultation, normal bowel sounds heard. Digital rectal examination, rectum empty, no growth felt and glove stain negative. Other system examination. CVSS1, S2 heard, no murmur. RS normal vesicular breath sounds heard. CNS no focal neurological deficit, higher functions normal. Spine and cranium normal. Summary. A 62 years old chronic smoker presented with a lump in right lower abdomen and pain in the same area with H/O easy fatigability, blood in stools, altered bowel habits, loss of weight and appetite. He was a chronic alcoholic in the past with no significant family history. On examination, patient is pale, a non-tender, fixed mass is felt in the right iliac region of size 5 by 4 centimeters, irregular in shape, firm in consistency, with irregular surface, with ill-defined margins. Extending medially 6 centimeters from umbilicus. Laterally 3 centimeters from anterior superior iliac spine. Superiorly 7 centimeters from right costal margin at midclavicular line. Inferiorly 8 centimeters from pubic symphysis. Impaired note on percussion. Provisional diagnosis. A case of right iliac fossa mass probably of malignant etiology likely to be carcinoma cecum. DD. Ileocecal tuberculosis. Appendicular mass. Investigation. Routine. Blood investigations: hemoglobin, total count, differential count, ESR, blood grouping and typing. Blood sugar, urea, serum creatinine, electrolytes. Urine albumin, sugar, deposits. X-ray chest, ECG. Specific investigation. Ultrasound abdomen. X-ray abdomen. CT scan abdomen. Barium meal follow-through. Tumor markers CEA. Colonoscopy. Treatment. Carcinoma cecum, right hemicolectomy with iliotransverse anastomosis. Thank you guys.